Have y'all seen this? They are so cute. Welcome to She Knows DNA. My name is Miavana and I am a board certified genetic counselor. Now that I have graduated and am a practicing clinician, it shocks me how many people either do not know what Down syndrome is or they have this unrealistic version in their head of how it affects people. So with that being said, cute. Let's get into it. Starting off with the basics. So we all are supposed to have 23 pairs of chromosomes, meaning of chromosome 1, you should have 2, and that goes all the way down until chromosome 22. The 23rd set are going to be your sex chromosomes, so there's either going to be 2 X's or an X and a Y. With Down syndrome, however, they have 3 copies of chromosome 21 rather than the 2 we expect. When it comes to features and symptoms of Down syndrome, usually the first thing that pops in your mind is their unique face. So specifically, some of those features for Down syndrome include that poor muscle tone, short neck with excess skin behind their neck, that flattened face with the nose and the up slanted eyes. They may have what we call Bushfield spots, so white spots in their eye, short fingers, short toes, and the list goes on. When it comes to the mind and even developmental wise, they are going to meet milestones. It just may take them a little bit longer. And then as far as their cognitive abilities, it ranges from mild to moderate. So that includes social skills or maybe needing more time to gain concepts and things of that nature. So with that, it helps for them to have extra support, especially when they're in school. Other features that most people may not hear about all the time are there can be abnormalities and problems with the heart, with the hormones. Sometimes those persons with Down syndrome are infertile, and even with cancer, they are more at risk of having leukemia. There are actually 3 types of Down syndrome. The most common one is just that basic trisomy 21. So we would maybe even consider it complete trisomy 21, meaning that during the division of those cells, they just didn't act right, and now we have some cells with way too many, hence having a baby with 3 copies of that 21st chromosome. Another type of Down syndrome we consider mosaic. Mosaic means that there are different types of cells in the body. So let's say 50% of them have the normal 23 pairs that we expect. That other 50% has 3 copies of that 21st chromosome. And there can be all types of different combinations and percentages, but just know essentially that's what mosaicism means. And this accounts for about 2% of all Down syndrome diagnoses. And the third category is translocation Down syndrome, which makes up about 3% of all diagnoses. Now, this one's a little bit more tricky because they may have a full chromosome, an extra chromosome, or that extra piece could also be partial, so just a piece of it. And really what happens there is that there is some DNA information, especially pieces of chromosomes, that are not where they should be. And so whenever that body is forming, then things kind of go all out of whack. So with translocation, you may see a full one, but likely it just may be an extra little piece of chromosome 21 on top of the other 2 full ones, and then you know what happens after that. The highest risk factor that a person could have that would result in them having a baby with Down syndrome is going to be the mom's age. You do not have to be 35 years or older in order to have a baby with Down syndrome. So as they get older, then the risk associated with having a baby with Down syndrome or any other type of chromosomal abnormality increases. And we begin to tell you more about it whenever you turn 35. A question or comment that I get from some of my patients are, how can I have a baby with Down syndrome, but yet I don't see it running in my bloodline? And that is amazing question because majority of the time it is not inherited. When I say majority of the time, I'm meaning like 99%. There's nothing that's going to be in your family history that would make me indicate that y'all are at a higher risk for Down syndrome or having a baby with Down syndrome. I know I talked about that 1% that's on the flip side of that 99, but 1% of persons with Down syndrome do have some type of inherited trait that ended up with them having Down syndrome, but I'm not going to dig into that. That's going too far. So just know basically that it's not inherited. Mom's age is going to be the highest risk there. Now, whenever couples are coming together and having a baby, whenever you're in that pregnancy, there are a number of genetic screenings. One of them is called a non-invasive prenatal screen. It does screen for Down syndrome or trisomy 21. That is the best genetic screen that we have in the prenatal side. And then on the other hand, some of these features can be seen on the ultrasound. The issue is when it comes to Down syndrome, only 50% of babies that actually do have Down syndrome will have an abnormal ultrasound. So literally flip of a coin, and that is why there are some parents that they don't know that their baby has Down syndrome until they're born and we're looking at them because nothing was popping up on their genetic screenings, nor was anything popping up on their ultrasounds. So another question parents ask is if they have one baby with Down syndrome, does that mean that it'll happen again? And that one is an easy yet tricky answer because there are some scientists that believe that the parent or that next child is at a slightly increased risk. However, though, between the pregnancy of the one that had Down syndrome and then the next one, that means mom had gotten older. So technically, the risk is higher than it was with that first baby. That makes sense? One last thing, I know you all saw the picture at the beginning with the twins with Down syndrome, and yes, that is a thing too. Remember, identical twins have the same DNA. For fraternal twins, they have different DNA. However, it's just like siblings, and so we do know that going up with age, those fraternal twins, both or just one of them, may also have Down syndrome. It's all possible. So I know that was just a snippet of what all Down syndrome entails, but if you are curious and need more information about it, or let's say that you yourself has a family member or child that has Down syndrome and you want to know more ways to get information or find support, please feel free to hit me up. There's a lot of resources out there for families, caregivers, and those patients with Down syndrome, no matter which type they have. I hope y'all learned something today. And now to leave you with words of wisdom. So child, listen, just know I had a time this past weekend. I had to go back home to attend 2 weddings. But the wisdom that I want to tell you all right now is when it's time to throw the bouquet to the single ladies, right? Don't believe the bride when she says that she will throw it your direction. I personally talked to both of them. One of them was my church cousin. The other one was my good friend, little sister. And they both was like, Mia, I got you. They lied. I'm gonna let that sit in y'all spirit. Because why would they do that? Why? They looked at me in my face. I cried ugly tears. Well, close to ugly tears, but I cried. I was looking good. I was ready. And you lied to me. I'm going to let that sit in y'all spirit, and the rest of you, take heed. Take heed. We have some liars, some lying brides when it comes to throwing the bouquet to me. Not fully. They're great people. They're Christian. They're beautiful. They're intelligent. They're not liars like that. But I just needed to say that just about the bouquet, but not calling them, like just liars, okay? That's the disclaimer, okay? All right, y'all. Let that sit in your spirit. I know you agree with me. Comment at the bottom if y'all have any ideas to help me. Well, that's all I have for today. Thank you so much for watching this video. Please feel free to like, comment, subscribe. And also, I am doing that talk this Thursday at noon. It is a virtual talk with myself and some other genetics professionals just to tell you about our journey and what it is we do. If you want to attend, especially those that are in undergrad that have a desire to get into STEM, please click the registration button below. If you have any questions, let me know. But otherwise, God bless you and keep you. And y'all have a wonderful, blessed rest of your day. See you next time.